Thank you, fellow defenders. I am Perttu Halonen, working at the National Cybersecurity Center Finland, which is located in the Finnish Transport and Communications Agency. That's the Traficom on the slides. And I got curious, Finland being a small country and maybe not the main target for ransomware actors, but still ransomware being such a global phenomenon, and then I was looking our incident reports that we get from the Finnish society and actors there. It struck me that so few incident reports regarding ransomware from Finnish healthcare, and started thinking why. So trying to dig into that. This is not a scientific research, rather than it's a philosophical journey into various reasons and points influencing the phenomenon. I use the ENISA's definition of the term ransomware. It covers both the encryption of victims' data and also exfiltration of the victims' data and the subsequent extortion. In the slides, I use the Finnish notation of numbers, where the comma is the decimal separator and the space is a thousand separator. So, Americans, please bear me. A few words about myself. Doesn't click. Oopsie. Operator, please. There we go. Yeah. Actually, I've already pretty much introduced myself. I'm a kind of a sector specialist for healthcare sector in the CSIRT, national CSIRT, and interfacing with the healthcare organizations, the CISOs, especially there, and a couple of other sectors. On my free time, I'm a husband, father, and volunteer firefighter. There's a picture from one of our festivities. So my key messages, I start quite straightforward there and go more deeply through these throughout the presentation. So the Finnish healthcare is mainly based on public healthcare. There's a portion of private healthcare also, but really the public healthcare drives the healthcare delivery. And there's the personal liability of the civil servants that I think influences the preparedness, cyber risk management quite a lot. Then as a national CSIRT, we provide some specific support for healthcare organizations that might make a small but significant difference. Well, Finland being a small country, even the biggest organizations in Finland are globally quite small, and I think the criminals easily find more lucrative targets elsewhere in the world. So that might be the most important single thing influencing here. Then another side of the small country, the hierarchies are low, and the kind of peer-to-peer support between ICT and cyber experts on the healthcare sector is significant, and like small steps, but many of them, so makes a difference. And then last, no Finnish healthcare organization, to our knowledge, has ever paid a ransom, and that's a strong message, both to the criminals and to the kind of defending side also. Then about my key assumptions, need to state them clearly. So I assume that ransomware is run by, most of the time run by financially motivated criminals. There are, of course, nation-state players using the same tools, but most of the time it's, I guess, normal criminals, organized crime. Then the cybercrime in general is inherently international, so makes sense to have a really global view on the topic. I think ransomware actors, especially ransomware actors, where they need to invest some human time into the breaches, they are rational decision makers. Of course, they don't have always perfect information about the victim and law enforcement activities and so on, but they do kind of reasoning about how to make best outcome, best income for them with the least effort. And then about where was I going? Need to check my speaker notes. Then the ransomware incident being such a really severe incident for any kind of organization, that I think increases the likelihood that the victim reports that incident to authorities. So I believe that national authorities have a better situational awareness regarding ransomware incidents compared to the other sorts of malware incidents. And that, I believe, also shows up on open source reporting, because ransomware incidents quite easily have very visible impacts to the victim organization. So media makes at least good guesses that now they have a 2-day outage there in ICT systems, so maybe it's ransomware. And ENISA, for example, the European Cybersecurity Agency, collects quite good statistics based on this open source reporting. And I assumed when I started doing this study that this would be a great source of information to compare the different nations, like how much ransomware impacts healthcare in each country. But then I found out that there are lots of statistics, but they are all a bit different, and the sources of information are not always so clearly stated. So I had to kind of refocus my study, and fortunately I found a couple of very good analysis and statistics from the United States. You know, it's a really an epidemic in the United States. The ransomware actors really hard hit the healthcare sector in States, and Microsoft has published good analysis and articles about the topic, and the federal agencies have also published things. So I found good comparable information from there, and that's the reason then I compare here the American and Finnish sectors. Finland being a small country and United States being a large country, the direct comparisons make maybe not so much sense, but then maybe relating to the share of cross-domestic product or that sort of things makes more sense. So let's dive into that soon. But how big a problem then the ransomware is actually for healthcare? Globally, 5 to 8% of ransomware victims are healthcare. That's according to many sources. For example, ENISA threat landscape estimates this sort of things. Then there are some surveys made. For example, Sophos made recently a survey. Up to 67% of healthcare organizations feel that they have been victim to ransomware. That's a high number, and I think that needs to be taken with a grain of salt, because it's a survey. It's not a scientific research, and somebody answers to the survey, another doesn't. But at least it tells that the healthcare industry really feels the pain of ransomware. But most interesting thing I think here is that ransomware has visible impact on people's health. It's hard to say that this or that patient died because of ransomware incident, but on population level, it's really a visible impact. In a scientific research paper, researchers studied those American hospitals that are neighboring to a hospital that just got victimized by ransomware. And what happens then? The victim of the ransomware needs to dispatch their patients to the surrounding hospitals because their capability to deliver the care dramatically drops. But what happens in the neighboring hospitals then is that more patients, the care personnel is more busy, and the delays for critical healthcare delivery increase, especially in ischemic stroke cases. That's the medical condition when the blood circulation in the patient's brains is blocked for some reason, and the start of the care delivery is a kind of question of minutes at the most. So there, that kind of impact is seen that those patients suffer from the aftermath of the ransomware case. So summa summarum, it's a really a burning problem. Well, then the Finnish side. I made some statistical comparisons, assuming that criminals follow the money. Then, if there's more money in some sector of society, then maybe more crime is more of this sort of targeted crime is kind of hitting that. But that's actually then not the case. There are very interesting differences in the shares of the gross domestic product compared to the share of ransomware incidents reported to us during these 3 years, 2022-2024. And the healthcare sector is depicted there in the red color. So 9% of Finnish gross domestic product is spent on healthcare, both public and private services. And only 3% of the ransomware cases that we got reported on were hitting the sector. So kind of a striking disbalance. And then in the opposite direction, let's take the ICT sector. 4% of gross domestic product going on through that sector, but 19% of the ransomware cases. And that's also curious when we compare to the right-hand side bar graph, where the cyber maturity, the cyber risk management maturity of various society sectors are depicted. The Finnish Emergency Supply Organization does this every 2 years, this kind of assessment of hand-picked but representative sample of actors on those sectors. And healthcare is doing pretty okay. It's not the best one, but not the worst performer in terms of risk management. Whereas the ICT and software sector, being one of the top there, and still they get more victimized by ransomware. So this is also an interesting point. Let's dive into that a bit later. About the 2 cases in Finnish healthcare during these 3 years. Still in 2022, the primary healthcare was on the responsibility of municipalities. So one municipality got victimized, and the ransomware attack particularly impacted the appointment reservation system. So it didn't stop the care delivery, but made some delays in the non-urgent appointments. The case was solved in about a month. Slight impact, but not a severe case like in an aftermath. Of course, in the acute phase, you can imagine that there was lots of people in a hurry, kind of figuring out where this incident is going and what will be the aftermath. Then the second case was an elderly care company, middle-sized one. The incident hit only a file server with administrative data, no patient data there, and kind of minimal or no impact to the care delivery at all. In Finland, this case would be classified as social welfare services incident, but in the, for example, ENISA statistics, I believe I haven't interpreted it right, that it could be seen as care delivery, healthcare also on that respect. And last year, no incidents reported to us, and I believe that's really the case. Also, according to open source monitoring that we do, we didn't notice any ransomware hits from Finland to healthcare sector last year. Now the Finnish healthcare system, 78% of healthcare spending goes through the public healthcare. And that's a big share, but some of that money goes then as subcontracting to the various private healthcare organizations and companies. So starting from the beginning of 2023, there was a really big renovation and reform of public healthcare. This municipal system was merged into 21 regional these welfare districts or counties. And then a special case of city of Helsinki, which manages this on their own. By the way, the Helsinki city data breach, as my colleague Matias Mesia talked about on Monday, didn't specifically reach to the healthcare delivery, but of course that was initially a concern. How far will the waves go there? But afterwards, it was clear that the healthcare was safe on this respect. Then the the private companies on healthcare, 5 big ones, and then hundreds of smaller ones, middle-sized ones, mostly doing elderly care or something like that, assisted living stuff, and then thousands of small entrepreneurs like small dental clinics or private entrepreneurs providing physiological care or something like that. Then pharmaceutical industry, one big national pharmacy, and then hundreds of middle-sized or small ones, and then on pharmacy manufacturing of pharmacies, it's one big company, then tens of smaller ones, and very concentrated wholesaling of medicines, only two companies there. And then Finnish specialty, National Social Insurance Institute, called Kela in Finnish, and they have big responsibility on operating the national e-prescription and electronic health record database, central database. It's kind of a backup system for the care delivery organizations, but still a major target. So they need to be very aware, and they are very aware in Kela of their responsibility. They are doing almost all the ICT services in-house, so it's a really big ICT house also, and might be a good kind of it might explain also why it's also very coherent in their cybersecurity efforts. Yes, now the actual details. Let's start from social aspects of cybersecurity and comparisons between US and Finland. So what really kind of was clear to me after short research on the topic, there has been since 1970s an annual ICT fair specifically for healthcare organizations, and it's continuing still annually. And I think over the decades that has created really comprehensive peer-to-peer network of ICT and cybersecurity experts. And because of the Finnish low hierarchy society, it's easy to reach out even to the competing organization or company that, hey, could you help me with this kind of how to, let's say, configure this new piece of security control firewall, or how to implement effective awareness raising campaigns for the personnel also. There are health ISACs both in US and Finland, but the Finnish one was established only 7 years after the US one. So that at least doesn't explain why Finland excels in this respect. I'm doing almost daily cooperation with the health ISAC, with US Health ISAC, which is nowadays global actor, and they are doing terrific job, very good job. But still something missing from this equation because so deep impact in the US healthcare by the ransomware. Then ICT and medical technology. There are certainly similarities between Finnish and US healthcare. It's very far digitalized, but vulnerability scanning services that both my agency and CSIR in the US provide, there's a slight difference in the marketing. So we specifically market and provide these free vulnerability scanning services to healthcare organizations, and maybe that has made some small but still significant difference in the game. There are certainly outdated systems everywhere in healthcare because of the medical devices need some backwards compatibility and the updating of the software. There's the approval process which takes easily a year or more and so on. And maybe healthcare even isn't so much different from other industries like, let's say, food industry, where there's lots of industrial automation and with the same kind of problems of the legacy systems and kind of not patching stuff because the operators don't want to interrupt the daily production. There's, of course, lots of complexity also into the ICT systems for various reasons, but kind of maybe the combining point is that mergers, large or small, between organizations brings more and more of that legacy that needs to be kind of consolidated under one control, and that takes time. Then, yeah, Finland being a small economy, so criminals easily find bigger fishes elsewhere, and yeah, even the biggest organizations in Finland, they are rather small. Nokia was a big one back in the days, but nowadays not so big one anymore. Then Vastaamo incident. No ransomware speech goes without saying that this private psychotherapy clinic Vastaamo incident back in 2020 was really a disaster for Finnish society. That's a case where people died because of this incident. So the patients going to see the therapist and telling all their most dark secrets about their mental issues, and then the ransomware actor leaking this information to the public drove some people to commit suicide. So really a disaster for society, and the politicians took this very seriously. So the Finnish government issued a resolution of information security and privacy in critical sectors, of course including healthcare. And this is really driving the comprehensive development of cybersecurity in Finnish society. Very much follow-up work from that. Then regarding norms like laws, I mentioned in the beginning that because the public servants in the public healthcare are personally liable because of how the law is written in Finland, of their decisions or lack of decisions, also regarding risk management and cybersecurity risk management. That has, I believe, created a continuum over decades that with the small amount of money that the public healthcare has in their hands to spend on cybersecurity, they make kind of wise investments and long-term investments reaching many years forward. Then GDPR, Finland being a part of European Union, and Finns being quite strict about following any rules, and also this GDPR, I think it has also impacted somewhat positively to the cybersecurity, but it's not so old regulation yet, so maybe the impact so far isn't so deep regarding this ransomware threat, but influencing positively still. On the reputation and relations, so I think it was Microsoft who said that up to 53% of the American healthcare organizations who fell victim to a ransomware incident did pay the ransom. And that's quite a lot compared to the zero, to our knowledge, in Finland. And that's a really message for the criminals that, hey, they smell the blood. Here's money and some willingness to pay, and that's kind of a circle that repeats itself. And I believe it's really hard to break, because it's a message also for the victims or the defending side. That's okay. Yeah, the neighbor paid and got along, so maybe we also pay, and eventually if we get hit. So yeah, very difficult difficult to say how to break that chain. Then about this ICT, I mentioned in the beginning that why is ICT sector doing so bad against ransomware in Finland? And I think it's the reasoning of the criminals. They know that the ICT sector is having really good standards regarding cybersecurity, good protections and so on, but still they acknowledge that they are kind of big targets in the sense that their businesses are really easily disturbed because of ransomware, and if the threat actor gets through, then it's more likely that the victim will pay. And also because the ICT providers are quite close cooperators with us as a national agency. We do lots of voluntary cooperation with them. They are actually maybe more likely to report any incidents to us. So there might be also this kind of bias in the statistics in this respect. So summarizing the public sector-driven healthcare in Finland, some specific targeting from the authorities to support the healthcare sector. Then it's small size of Finland, small amounts of money for the possible threat actors, and a low hierarchy and peer-to-peer support. And this is lack of payments in Finland. I think these sum up some most important reasons why Finnish healthcare is doing so well. So that concludes my speech. Thank you for listening, and time for discussion.
Fantastic. Thank you so much for a very interesting presentation and right on time.
Ooh, thanks.
Before we go to the Q&A, just a reminder about filling out the session survey in the app. So, do we have any questions for Perttu? There is one coming there, and two.
So I'm curious if you looked at the language as a factor in target selection. Hey, I'm here. Sorry,
Oh, yeah, no,
I apologize.
yeah.
Yes, I was curious if you have considered the language as a factor in the target selection. After all, this is additional overhead that the attacker needs to endure, and this just increases the cost of operation for them. And have so many, free targets, in the US, it's much easier to go there.
Yeah, I guess it's also a kind of a good point that Finnish being quite an obscure language, but given the large language models translating any language to any language, it's not a problem anymore. I hope that will not turn against Finland. So we have certainly got advantage regarding, for example, phishing, which historically has been very low quality against Finns because the language is difficult for the criminals that are not so often Finns themselves. And the quality of the phishing has certainly increased now with the freely available large language models. But yeah, then the kind of intelligence gathering of the criminals, the obscure language maybe makes it more difficult for them.
It's just an additional step. You have to do extra work, instead of going and partying with your friends. Now, just a quick follow-up on the disparity between ICT or critical sector ransomware and healthcare. Have you also considered the possibility that maybe some of those are nation-state actors which are run by militaries, and they may in some way be honoring the wall of war, so they may be avoiding healthcare targets?
Yeah, well, I didn't consider that in this research, but they are a good point. We know that, for example, the North Korea does ransomware attacks just fund the military budgets and kind of circumvent the restrictions. But yeah, I don't know in more detail about that.
Yeah, thank you very much.
Thank you.
Hi, I just have a question about, you had a conclusion about why you thought about why you are not getting that much attacked. Are you seeing in the future that threat landscape might change? And what kind of initiative are you going to possibly set into motion to address future landscape?
Threat landscape certainly is moving all the time, but I think the NIS2 directive changes also the protection. So I'm hoping that we get even more protected in the future. But yeah, hard to say what is going to be the next step from the adversary side. This large language models certainly impact there because in many cases the ransomware attack starts from a phishing case, so it's a constant game of cat and mouse. And, yeah.
Thank you.
Yeah, over here. Yeah, so I just had, I thought it was pretty interesting when you were showing the maturity that the finance sector kind of wasn't at the top, but it looked like they were at like 0% share, if I saw.
Yeah, that's right. Finance sector never got in that 3 years period victimized. Yeah.
Yeah, so I'm in the financial industry. I think we usually, in the US, it's pretty tight in terms of like security and so forth. It was interesting though that, that didn't seem to reflect in the maturity numbers. So it's like by these measures, that are being used to assess everybody, it's like they're not the best. But then if you look at the metrics, they look maybe pretty strong here. I was curious if there was any lessons maybe that you were able to extract, or if you focused on why that might be that 0%.
Yeah, well, the finance sector has been regulated on many aspects of risk management, including cyber risk management for so long time. So they have had time and they have got high goals where to aim. So they're more demanded from them. They have kind of evolved their risk management better and better. So that's also kind of, I'm as a civil servant proponent for adequate level of regulation. So I really thank for the NIS2 director, for example, for setting the bar a bit higher for society at large.
Yeah, they make my job very hard, but make me better at the job. So,
yeah, thank you.
Super. Thank you so much for the good questions. And time's up. It is now time for lunch. Thank you, Perttu, for a very nice presentation.
Thank you.